sensitive subject we all need to talk and think about. Here now is Jennifer Graziano and Time to Talk.
Good morning, Westchester, and Happy New Year. It's 9 a.m. on Monday, and that means it's time to talk with me, Jen Graziano. I'm a licensed funeral director who oversees my family's funeral homes, Cox and Graziano of both Mamaroneck and Greenwich, and the Zion Memorial Chapel of Westchester. Every Monday, I come to you discussing important topics and sensitive matters that all of us need to pause and reflect upon at some point. And through this show, I hope to provide a platform to do so. Good morning, Vinny, and anybody else in the control room. If we'll take your questions, comments, and calls to 1460 WVOX, a Whitney Global Media Station, at 914-636-0110. And good morning, Tim Judge, GreenwichLocal.com. Good morning, Facebook Live viewers. Happy New Year. Happy, healthy New Year. And on that note, let me introduce my callers on the line, my guest. I am excited to once again be speaking to part of the team of Glenville Medical Concierge, some new voices from Glenville Medical. So I'm quite excited to be joined by Dr. Cerrah Mendelsohn, who's recently joined the practice, and Dr. Stephen Mackley, who's dedicated so many years to bettering the health and wellness of the community. Doctors, are you on the line?
Yes, we are.
Here we are.
Good morning, and thank you so much for joining us this morning.
Thank you for inviting us.
Yeah.
Well, I'm quite passionate about the concierge model. As you know, there's been many shows with Dr. Jeff Puglisi, Dr. Erica Kraus, and, in full disclosure, I am, I'm a patient of the practice, and I think that allows me to speak better to the difference of the concierge model and truly an unsurpassed level of care and attention to detail. So you certainly get what you pay for in life, but I do think that the concierge model allows for more meaningful doctor-patient relationships and more meaningful healthcare visits. Dr. Mendelsohn, you're a new part of the team, correct?
Yes, I just joined this past month.
Well, welcome. Happy to have you on. Can you tell us a bit about your background and why did you come from another concierge medical background, or is this your first time stepping into a practice such as this?
This is my first time stepping in. I actually hail from California, and my background, I trained in emergency medicine, where I practiced for 16 years in Manhattan and out in Greenwich, and decided after a period of time, and particularly after COVID, that just actually being able to spend time and interact thoughtfully with my patients. Things have been on fast forward for everyone, I think, and I wanted to step back and be able to re-engage and go back to the real reason why I decided to pursue medicine.
I think that is the heart of the difference right there. It's medicine the way it was intended, medicine the way it used to be, these meaningful doctor-patient relationships, these in-depth conversations, being able to look at a patient wholly, fully, to understand, even what's going on in their lives at the time and trying to connect the dots to their physical health. It can't be understated how important that is. Now, Dr. Mackley, on the other end, you have had how many years of service to Glenville Medical?
Since 1978.
Wow. So were you at the creation of the practice, Dr. Mackley? Were you among the founding?
My wife and I started the practice in 1975, actually, but it became Glenville Medical officially in 1978. We started off with 0 patients. And we just built the practice gradually over time. And over time, we added new people, new partners, Judy Shea, Jeff Puglisi, Ralph Cipriani, Erica Kraus, and now Cerrah Mendelsohn. So it's been a long, complicated journey as medicine has changed from a cottage industry where offices were, 1, 2, or 3 doctors, now to an industry where most doctors are actually working for some huge entity like Yale or Westmed or something like that. It's totally different. But Glenville is independent and basically really makes its own decisions and tries to make those decisions in the best way for the patients.
So you've seen so many changes in the medical model during your tenure, Dr. Mackley. I think what was it watching these mergers and acquisitions of medical practices and how patient care often gets sacrificed in that? Was that part of your impetus to move towards the concierge model and your commitment to maintain independence?
Yes. On the other hand, I think we always were careful to take care of the entire patient and not just whatever disease or acute problem they might have. But you're correct that as the practices have been bought up really or controlled by bigger entities, they are really profit driven and volume driven, which means that in short form, the visits got much shorter and were not really designed to look at the person or how, for example, your personal life and personal stresses impact your behavior, number one, which may be detrimental, and also your physical problems and performance also in your personal life at home and your work life, if you really have issues that conflict with what's going on.
So true. And I was on the morning show this morning, just, promoting our show today. And again, I had an annual physical at your practice, and it was such a thorough and comprehensive discussion about results and findings. And Dr. Kraus really was getting to understand, me as a whole and all the things that you just described, because it paints a picture and it all contributes to, actual findings and results. And it enables you, the patient, to go forward mindful of stress and health and general concerns and just live an overall healthier lifestyle. And I think at the start of any new year, that's on the forefront of everyone's mind, how to be healthy. So I want to talk to both of you a bit. In your opinions, what are some sustainable health goals? I mean, a lot of times resolutions fail because they're just overarching and they're just, they sound great, but they're just not as great in practicality as they are on paper. What are some tangible, sustainable health goals that you would advise listeners and viewers today to take on as the new year begins?
That's a great question. I think every year people set these wonderful goals for themselves at the new year, right? I'm going to eat healthier. I'm going to exercise regularly, reduce my screen time. But I think we all often find ourselves falling off after a few weeks. And I think what is key in sustaining any goal that you set is being mindful about it and being kind to yourself and setting goals that are attainable and not expecting to cross the finish line right away, and taking small steps to achieving a particular goal.
What is the importance of the annual checkup, the annual physical?
I think the annual physical, just to give you an idea of sort of how we do it, I had a nurse who used to get her annual physical, actually, I won't say through what big institution, but one of them, and her entire exam was 20 minutes.
Wow. 20 minutes, annual exam.
How the heck can you do that in 20 minutes? I mean, if you come here, our whole design is to make sure that we have plenty of time to assess you and your problems and do them in depth. We don't schedule any visits for less than 30 minutes. The annual physical probably will take you an hour and a half to 2 hours or more.
Yeah, very true.
And yeah, they really do. And they really are designed to not just examine you, but to look at every aspect of your health history, which includes looking at each organ system, reviewing your family history, where we look carefully to make sure there's nothing that would suggest, for example, a genetic problem that you might inherit from a parent or you might give to a child. Things like BRCA genes, which are in the minds of women, but we forget that they also affect men. And prostate cancer, melanoma, those sorts of things actually are part of the BRCA gene picture, and I think are overlooked. And there's certainly no way in a 20-minute physical that anybody is going to things like that. And we combine that with a very thorough physical exam and a follow-up with the patient at the end of the exam to make sure that they take home are present. And typically they get something in writing as well at the time or soon thereafter to make sure that the important points at the exam really are delineated so that, you don't forget. You think you remember when you leave the office, but I am certain that if it isn't somehow written down, you are not going to really remember everything.
And Dr. Mackley, I can again speak firsthand to what you just described. That is so true. You have your annual physical at Glenville. You go in for a blood test about a week or so prior, and then you're brought in. I don't think I had any wait time at all, and sat down right with the physician to go through a hard copy of results that were handed over. And then it became this thorough questioning of family history, lifestyle, understanding everything from home life to work stress. And,
yes.
There was, and I'm in my young 40s, physically fit. So, seemingly it should have been a quick visit. And there was a minor issue of a blood result that just, probably wouldn't have even been looked at in just a general run-of-the-mill practice, because it wasn't something that was going to throw off bells and whistles. However, your team, Dr. Kraus, took the next step and then went one more step because she really wanted to uncover what could have been underlying. And, knock on wood, thank God everything's fine. But it really showed you, I can firsthand illustrate the difference of the concierge model. You're not a number. You are a person, not just a patient. And if they can give that type of care to someone with seemingly no health issues, it makes you realize if there is a problem, this is where you want to be. So what you just described, I can fully attest. You're spot on, doctor. That's exactly how it's done at Glenville from the patient perspective.
I think it's a very personal relationship. And that's one of the wonderful things I think about being a concierge physician is that you actually really get to go on the journey with the patient, help them with it, and they help you indirectly the same way, and help share in their wonderful outcomes and also be helpful when things don't go well. I would also say that doing the blood tests in advance overall is a very helpful thing for the doctors because sometimes you do unroof things on those blood tests and the doctor will have looked at them before you come and can add things to the tests that were done already so that when you come, you really can have everything in front of the doctor to address, which is really great.
It really is. And good morning to Facebook viewers. Hi, Chris Ann, my good friend. I truly agree with your comment. By mid-February, we do give up on resolutions. So small goals are best. I agree. And actually, both Chris Ann and Glenville Medical can be found in our latest Coming of Age magazine. We'll talk a bit at the end of the show how you can get a copy of that. But very true, Chris Ann. So as Dr. Mendelsohn said, sustainable goals we talked about. We're hoping that everybody is taking away from the show this morning to be healthy. It's not hard to be healthy. It's not as arduous a task as some people might think. There are small things we can do, scheduling that checkup, being mindful of what we're putting in our bodies, the amount of sleep that we're getting. Dr. Mendelsohn, you said something about screen time, which I want to circle back to because I couldn't agree more that it's such a deterrent to our health. Psychologically, physically, emotionally, but in your medical opinion, doctor, how does screen time adversely impact our health?
So I think that speaking of mindfulness, it's being present in the moment, and we are so used with media to having so much information coming at us and also distracting us from what we're doing. I'm guilty that, I'll be doing a task and suddenly I reach for my phone.
Mm-hmm.
And, in being mindful, I have to stop and ask myself, what is it? Why am I reaching for the phone? Am I thinking about something else? Am I expecting some news? What triggered that urge? And so with all of the media, I think that we have sort of lost this ability to stop and just focus on what we are doing and to enjoy that moment. Whether we're with friends, family, children, if we're exercising, the feelings that we get from it. I think sometimes we exercise just to get through the workout and then move on to the next thing, right?
Right. Not without being aware of what we're doing. Yeah, absolutely, doctor. I agree with that. And, I think also the cluttering of the mind and the frustration that you can get, with even the 24-hour news cycles, it's this constant information, and it just can lead to anxiousness, and shutting that phone off is so important. And I'm just as guilty as you. I find myself reaching for it, but as I try to be an example for my young daughter, that actually does force me to, leave the phone like without a reach, when I'm certainly driving. If you have that tendency at the red light to check something. So I've been more aware to keep it away. And so when all eyes are watching you, that's the best way to modify behavior. Going back to the concierge model, and again, if you're just joining us on AM 1460, WVOX, or Facebook Live, I'm speaking with part of the Glenville Medical Concierge team, Dr. Cerrah Mendelsohn, who's just joined, and Dr. Stephen Mackley, one of the founders. We're talking about the concierge model, but also being mindful of our health. Dr. Mackley, would you really, the concierge model is more of a proactive approach to health versus a reactive. Would you agree with that?
Totally. I mean, I think the one of the pillars of what we really do here is try to do preventive medicine. I think the whole point is that more than 90% of the cost of medicine in the United States is spent on treatment, and only 10% on prevention, which, if you think about it, does not make good sense.
No.
It's largely driven by the fact that there is very little time for most doctors to do anything preventive. They just put their finger in the dike and try to stop whatever is happening at this particular moment. So I think that for us, the thrust of every visit is to look at you as a person and try to incorporate your health habits and how to help you perhaps with them. And, we've addressed some of those things, diet, exercise, sleep, things that I think are not addressed in other situations, but impact not only health, but also longevity. I mean, you can show that inadequate sleep shortens your lifespan. You can show that if you would drink more than you should, even if your liver tests are normal, that basically your lifespan is shortened. So these sorts of things come up at every physical exam, and we really are very careful to address them and try to be as preventive as possible. And that takes time, but we are want very much to do that. And in fact, I think we do that.
Well, again, I agree that you do. So, I'm sure you've seen an influx of patients. Everyone seems to be harboring some type of viral or bacterial infection. There's been, a rise in so many other types of viruses we haven't seen in a while. And it's argued that just collectively our immunity is down. We've been wearing masks for so long. So again, we're meant to fight viruses. We're meant to fight colds. But it's also, there's ways we can mitigate the effects of these viruses that we're bound to get. And that starts with this overall healthy approach as well. Everything that you're describing, correct? Sleep,
Yes.
Health, diet, exercise. I mean, they're not just, cliche advice. They actually have, very specific effects on the body. If you're healthy, you're going to fight something much more readily, correct?
Yes, all of that is correct.
Now, in terms of when you in your approach to patient care, Does it vary by age, patients in 20s and 30s versus 40s and 50s, and then 60s and so on? Do you have different approaches to the different demographic of patients that you see?
Yes, we do. And the exams are not identical, and certainly the questions asked, et cetera, are not identical from age bracket to age bracket. For example, if you take people who are older, one of the problems with getting older is that your physical being becomes older too. For example, balance is much worse as you get older. Fall risk is much greater. And if you combine that, particularly in women who have worse bones and many have osteoporosis, a fall risk really matters. And they are no longer cheerleading or playing football like they did in high school, and their core muscles are, and their core muscles are not as good. And therefore, as we get older, focusing on different kinds of exercise, for example, is quite beneficial, because if you work on your core muscles and do simple things like Tai Chi, which don't require a trainer, they don't require equipment, you use your own body weight to strengthen your core, then what happens is you decrease your risk of falling, and that therefore decreases your risk of getting a hip fracture, which can be disabling or life-changing. And that's the sort of thing to look at.
And also the muscle memory is there too. So if there is an injury, it's going to mitigate the downtime of that injury. The muscles will be
a statement. Yes.
Yeah, or more apt to repair. Another reason that I think annual physicals are so important, and health mindfulness, early detection. I mean, if you are seeing a patient regularly, you've established a relationship, you have, the baseline of blood tests and charts from year to year. If something should pop up, you're going to catch it quicker. And early detection is key. When you speak of cancers that are so prevalent in our society, more so now than ever, I don't know anyone whose life has not been impacted by cancer, someone, be it themselves or someone that they love. Early detection is key. So it's a relationship with a trusted physician who's really, again, going to take the time to look for not just what they see, but what they see could potentially happen. That's so important.
Agreed. And I think every one of us here, for sure, we spend the time before you ever come to review everything that's happened to you in the past. And we already have a really good idea about exactly what happened in the last X years and all the way back to when you first came here, so that when you come in, we have a comparison. And often, for example, I will run cumulative tests so that you look for the last 5 or 10 years of, what was this person's PSA, to make sure that the change in the PSA is not an outlier where it would suggest for men that maybe even though you're in the normal range for PSA, the change from last year is more than you would expect, and therefore it warrants more careful attention because you have a higher risk of actually having an occult cancer of the prostate, which is a common problem. Okay?
Mm-hmm. It really hits home for me, doctors. I lost my mom to cancer. She was young, and one of those things that was overlooked, and a late diagnosis. So I'm a very big champion of early detection, and exactly what you're doing, just going above and beyond to dot your I's, cross your T's, and check off all the boxes. You are seeing new patients in the practice, Dr. Mendelsohn. I'm sure you're going to build your practice. So new patients are welcome, correct?
Yes, absolutely.
And very easy to get an appointment. Why don't I have you give the phone number and website right now to Glenville Medical? Because also they can learn more. I encourage everyone to take a look at the website following our discussion today.
1808 203-531-1808. The same number since 1978.
Dr. Mackley, I thank you for your years of service. You have really been an institution in the community. Everyone knows you and they respect you, and you've created something wonderful that's been long lasting and certainly sustainable, and it has a long way to go. So I credit you for that. And Dr. Mendelsohn, I know you have great work ahead of you. But the Glenville concierge model, a warm, welcoming practice where they're treating a person individually, really getting to know you. It's that, I keep saying old fashioned, but it is. It's that old fashioned doctor patient relationship, bedside manner, things that sadly we just don't see. The world doesn't allow for. It's not that doctors aren't well intentioned, but the constraints under which they operate don't allow for them to approach patients in the same way as years ago. So I thank you both. Any final words for listeners and viewers as the new year begins?
Just to keep being full and give yourself grace and just set goals that you can work towards, small steps, and be kind to yourself.
Yeah,
and enjoy the moment, because the world is pretty complicated, but it's still a pretty wonderful place, and we need to step back and recognize that.
Thank you, Dr. Mackley. Say hi to Lynn Lampo. She's watching us. She said you guys are the best. I agree, Lynn, and you're a great part of that team, too. Thank you both, doctors, and this is Jen Graziano, thanking everyone for taking the time to listen as we took the time to talk. Stay healthy, everyone. Visit Glenville Medical Concierge and give them a call today. Have a great day, Westchester. Bye-bye.